Okay, let's talk about bone sutures and landmarks of the skull and answer the what questions. What are the bone sutures and landmarks of the skull, and what are the cranial fossae? Hello, everyone. My name is Dr. Morton, and I'm the noted anatomist. Okay, so the skull is an Old Norse word that means skalli, or a bald head. So here we have a bald head, and we have a skull, and yeah, they both look bald. And so the skull, to cover it today, we're going to do the following. We're going to talk about the bones and the sutures and the landmarks in the following way. We're going to do bone sutures and landmarks in the anterior part of the skull, then lateral part of the skull, then posterior, then superior, then take the calvarium off and look at the cranial fossae with the calvarium removed, and then look at the skull base of the inferior view. Now, a note before we get started is that the perspective of this tutorial is towards health professional students. And so it's to the clinical relevance of each of these are the major structures. So if this is for like an advanced anatomy class with every single foramina, every single suture, I'm not be covering all of them, but I'm still covering a lot of them. So sit down, get comfortable, get yourself some hot chocolate, and let's get started. So we're going to first do the anterior view of the skull and talk about first the bones. Well, the frontal bone is located here. It's the part of the forehead because frontal is Latin for forehead, above the eyebrows. And so right there is where the frontal bone is located. Now the parietal bones are located on the lateral side of the skull, and they're ones that we're going to be talking about in another view. The sphenoid bone you can find in the lateral part of the skull behind the orbit and also within the orbit, but superficially the sphenoid bone is felt right behind the orbit, and it's actually what most people say they massage their temples. That's actually the sphenoid bone. The temporal bone is located above the ears, right about there. And then the zygomatic bone is the bone that's located right along the cheeks. So the maxilla is this bone here in purple, and it is Latin for jaw, and it's the part that's of the upper jaw and all the way up to the side of the nose. Now, the nasal bone is located here because nasal means nose. Now, is that Wonder Woman? Nope, it's Diana Prince. And you can tell because she's wearing glasses. And glasses sit right on the bridge of the nose on the nasal bones. Now, the mandible is the lower jaw here. And we'll talk about that in a few minutes. Let's talk about now sutures. The only suture we really see, the main one we see here is the coronal suture that goes up and down. We'll talk about that suture later on. Let's talk about the landmarks in the front of the skull. Well, the frontal sinus is located within the frontal bone. There's the frontal bone, and the frontal sinus are these hollow caves within the bone itself. And so in this x-ray, we can see the frontal sinus, and let's outline it there. There is the frontal sinus that it's used for. It makes mucus because it's mucosa lined inside, but it's a cave and it helps with the resonance of sound. And here's a lateral x-ray, and that yellow arrow showing the frontal sinus. Now, the supraorbital margin gets its name because supra means above and orbital means above the orbit. There's that margin above. It's the part that's right below your eyebrow, supraorbital margin. Now, in the supraorbital margin, there is a supraorbital notch. Now, sometimes it's a notch and sometimes it's a foramen, so supraorbital notch or foramen, and it traverses the following: the supraorbital artery on way to the front of the scalp, and the supraorbital nerve, which is also giving innervation to the front of the scalp. We take this section, now we're going to take and do this different view, and there's what's a structure called the supraorbital fissure, and then there's an infraorbital fissure, and then there is the optic canal. So let's do that again. So there's optic canal, superior orbital fissure, inferior orbital fissure, and we're going to now superimpose and blow that up. And let's talk about what's inside each of these. So the optic canal, superior orbital fissure, inferior orbital fissure. Now the optic canal contains cranial nerve 2, or the optic nerve that goes from the retina for vision. It also contains the ophthalmic artery that supplies the orbit and arises from the internal carotid artery. There's our superior orbital fissure that contains the superior ophthalmic vein, and then the following 4 cranial nerves, 3, 4, 5, and 6. Now, I did it in that order because it's easy to remember numerical order, 3, 4, 5, 6. Specifically, V1 of trigeminal. V2 and V3 do not go through here. Now, this is an oversimplification because supraorbital fissure actually looks like this, where there's cranial nerve 3 in upper and lower division, cranial nerve 4, which is above 3, cranial nerve 5, which has a lacrimal frontal and nasal ciliary branch, V1, and then cranial nerve 6 down at the bottom. But because if we take a look at the size of the supraorbital fissure, is just a couple of inches. So unless you go into eye surgery, this has been my experience is sufficient to know supraorbital fissure, that superior ophthalmic vein, 3, 4, V1, and 6. Now the inferior orbital fissure is the inferior ophthalmic vein, cranial nerve V-2, the infraorbital nerve, and then our infraorbital artery and vein. So there are the 3 major openings in the orbit. Now, the nasal lacrimal duct is located right there. Let's take another view right there. And that nasal lacrimal duct does the following. Here's the orbit. There's our lacrimal gland that, when innervated, produces tears that wash the eye and go down through this nasal lacrimal duct into the nasal cavity. Hence why when you cry, you actually usually get a runny nose. That is the nasal lacrimal duct going between the medial corner of the eye all the way down to the nasal cavity. All right, so now we're going to look in more of a going down, looking up. There is our infraorbital foramen right there, and that infraorbital foramen traverses the inferior orbital nerve there and our inferior orbital artery there as well, supplying the lower eyelid, lateral nose, upper lip. There's our inferior nasal concha and our middle nasal concha. And there is our nasal septum in the nasal cavity. So the mental foramen is located right there, and it traverses the mental nerve, a branch of V3 that supplies the chin and the lower lip. And then there's our mental symphysis, and there's a little notch in the mental symphysis, which is usually what gives that little dimpled chin, as you see in John Travolta. And so now we look at the skull on your right and this dermatomal picture on the left. There's the superior orbital foramen that gives rise to a branch of V1. That's where you test the V1 dermatome. And the infraorbital foramen gives rise to the infraorbital nerve, which is where you test the V2 dermatome. And the mental foramen gives rise to the mental nerve, is where you test the V3. So above and below the eye, the orbit, and then in the lower lip, the way you test the trigeminal dermatomal fields. Now let's do the lateral view of the skull and start with bones. And so here's our frontal bone forming the forehead. And then there's our parietal bone. And the word parietal is Latin for wall because it forms the wall of the cranial vault. And where do you see this term parietal? Well, the parietal pleura, which is the mesothelial lining of the wall of the lungs, or the parietal pericardium, which is the mesothelial lining of the wall of the heart. So whenever you see the word parietal, like parietal peritoneum, parietal bone, it means the wall. Sphenoid bone located here, it forms right behind the orbit. And then the temporal bone, which is located right there in this salmon color. And temporal means time, because if you're to add the ear onto that, that's where gray hair usually comes. And so what happens is when you take a look at the bone underneath where usually gray is, why it's called the temporal bone. The zygomatic bone is located here, where that word zygomatic means to yoke or bring together. I'll talk about why that's the case in a minute. And then here's our maxilla, which is the bone of the upper jaw. And then the nasal bone, which is at the bridge of the nose. And then there's our lacrimal bone, which is right inside the medial wall of the orbit. It gets its name because it's part of the nasal lacrimal duct, and lacrimation means to tear. That's where you're draining the tears. And then there's our mandible. Now, the term mandible is Latin to chew. And it gets that name because the mandible is what is responsible for this mastication movement of the jaw. And then there's our occipital bone, and the occipital bone is Latin for the back of the skull because occiput is the back of the skull. Now let's talk about the sutures from a lateral view. So the coronal suture is first, and the coronal suture is between the parietal and frontal bones right there. Shing! There's our coronal suture. And it gets its name because the word coronal is Latin for a crown of garland, and you can see where that crown of garland is located, and you look at the Suture, that's why it's called the coronal suture, because it is courses like a crown of garland. Now, the squamous suture or squamosal suture is between parietal and temporal bones right there on the squamous part of the temporal bone. And then the lambdoid suture is between parietal and occipital bones right there is our lambdoid suture. Now, the pterion is it's a significant little suture between parietal, frontal, sphenoid, and temporal bones. And it means wing because it forms on the lateral part of the greater wing of that sphenoid bone located right there. Now, clinically, it's important because if injured, for example, like hitting the head against the side of the car window when you're in a car accident, or in Canada, like a slap shot of a puck right into the side of the temple, if you're not wearing a helmet, because what happens is deep to the pterion is an important artery. So here in the infratemporal fossa is the external carotid artery that gives rise to the maxillary artery that gives rise to an artery called the middle meningeal artery coursing through that foramen spinosum. And then that middle meningeal artery supplies a good chunk of the dura mater. And right there is where the pterion is located. And so if you hit the pterion, deep to the bone is this little artery called the middle meningeal artery. And because of how thin the pterion area of the bone is, it could rupture and cause bleeding, separating the dura from the skull, forming an epi outside the dura mater collection of blood. Epidural hematoma. All right, now let's talk about landmarks from a lateral view. There's the external outside occipital protuberance there. And then there's the petrous part of the temporal bone. Now this part, that arrow is showing where the petrous part of the temporal bone is, but it's deep to this area. It's like basically running your hand over the ground, but what you're meaning is stuff underneath the ground, because the word petrous means rock, like petrified. And so in this lateral view of the skull, whenever you see bright white, it means it's very dense. And there is that petrous part of the temporal bone. It's housing the internal ear, like your cochlea and semicircular canals. Now, the mastoid process of the temporal bone is located right there, and the word mastoid is Latin for breast shape. Think mastectomy. And there is that mastoid process of the temporal bone, and outlined there is our sternocleidomastoid muscle, and the mastoid process is its insertion. In this lateral view x-ray, there is that mastoid process, but within the mastoid process are these mastoid air cells, which is like sponge-like formation of bone that communicates with our middle ear. Now, the external acoustic meatus is here, and the word external means outside, and acoustic means to hear, and a meatus means some type of a passageway. And so that external acoustic meatus is right there, the opening to the outside of the ear, where people used to put Q-tips. And I was going to make a whole thing about ear. Just be careful, don't poke your eardrum with it. Because when you look inside the external acoustic meatus right there, deep inside is the tympanic membrane, also known as your eardrum. Now, the zygomatic arch is formed by the zygomatic bone and its union to the zygomatic process of the temporal bone, and together they yoke together to make the zygomatic arch, hence the word zygote. If you think of that from embryology, where a zygote is the union of a sperm and an egg, zygomatic arch is the union between the zygomatic bone and this temporal bone. And it's located right there. And so that zygomatic arch all along here forms as an attachment for the masseter muscle, which courses down to the mandible, as well as deep to the zygomatic arch. This temporalis muscle goes deep and attaches to the coronoid process of the mandible. The nasolacrimal duct from a lateral view is located right there to drain tears into the nasal cavity. And then the ramus of the mandible, that word ramus means a branch. It's all along there, and that's where the masseter muscle attaches, all along the ramus of the mandible. And then the coronoid process located right there is where the temporalis muscle inserts to allow it to elevate both the masseter and temporalis to masticate. And then there's our mandibular condyle right there, which allows for this type of chewing motion. And then there is our mandibular notch. Okay, now the skull from a posterior view, and we'll start with bones. So the parietal bones are located right there on the side of the skull. Then the occipital bone is the back of the skull. and then the temporal bone, which is the side of the skull. And now let's talk about sutures. So the lambdoid suture is located between parietal and occipital bones, and it's located here. And that lambdoid suture gets its name because the word lambda is a Greek alphabet, like that symbol lambda is the Greek alphabet that looks like this, that upside down V, which looks just like that lambdoid suture. The sagittal suture is between adjacent parietal bones right there. Shing! So let's now talk about landmarks. So the external occipital protuberance is there and coming off, and protuberance means a lump or a swelling because that's what it is. Now the superior nuchal line is located all along there, with the word nuchal means the nape of the neck. And if you have a superior nuchal line, you must have an inferior nuchal line, which is located right there. And both superior and inferior nuchal lines are for muscle attachment. Now, the occipital condyles are there, occipital for occipital bone, and condyles, which means a knuckle or knob. And these occipital condyles located right there articulate with the C1 vertebra, also known as the atlas, that allows for the yes, up and down motion. The mastoid process is located there from a posterior view. And now let's talk about the skull from a superior view and start with bones. The frontal bone forming the forehead in blue, the parietal bones in green forming the major wall of the cranium, and the occipital bone in purple forming the back. And so for sutures, the first suture is a coronal suture between frontal and parietal bones located right there. There's our coronal suture in the coronal plane. Then the sagittal suture is located between adjacent parietal bones right there. Shing! And it's called the sagittal suture because if you remember in introductory anatomy, that plane that divides a structure into equal left and right portions is a sagittal plane or a sagittal section. Hence why that is the sagittal suture, because it courses in that sagittal plane. All right, now the lambdoid suture is between parietal bones and occipital bone right there, and you can see from the superior view, making that lambda symbol. Okay, here's a lateral view of the skull. We're going to do this, shing, and separate this calvarium and take the calvarium and look inside at the cranial fossa, or the base of the skull internally, and that's the cranial fossa. And so we're going to talk about the bones first. So the frontal bone in blue is the very front of the skull, and then in green is the ethmoid bone, and the term ethmoid is Greek for a sieve or a strainer, like to make spaghetti, because take a look, you make spaghetti of that, you can almost imagine using the ethmoid bone to drain spaghetti. Now the sphenoid bone is located here. I said bones, it should just say bone. There's our sphenoid bone, and it is Latin for wedge, because this bone is wedged right in the middle of the skull where so many other bones articulate with it. It also looks like a butterfly. And then parietal bones are in the lateral part of the skull. And then the temporal bones form a big portion of the middle cranial fossa, and that what I've shown there, a good chunk of that is the petrous part of the temporal bone. The squamous part's on the outside. And then the occipital bone, which I have bones, it should say bone. I mean, I get my plurals and singulars mixed up, sorry. And I've made this video 1,000 times already. It's supposed to be posted on Friday and it's Saturday. I'm going with it. All right, so now let's talk about the landmarks. And so the orbital plate is this part of the anterior cranial fossa in the frontal bone right there. And if you were to crack through that, you get the orbit, also the extraocular muscles in the globe. Now, the groove for the superior sagittal sinus is right there. The superior sagittal sinus is a dural venous sinus that anteriorly drains down, or it could be blood is coursing in either direction, but the groove is for the part of the superior sagittal sinus, just the anterior part. Then there's the cribriform foramina. Now that's the cribriform foramina. The term cribriform is Latin for sieve-like or riddled with small holes. And so it is because in this lateral wall of the nasal cavity, these olfactory nerves coming from that superior nasal concha here ascend up, and then they go through all these little holes, the cribriform foramina, and the olfactory nerves synapse in the olfactory bulb, which then goes out to the brain. Now, the crista galli is located right there. And crista galli is Latin for the crest of the rooster. And so how does that look? Well, let's take a look at another view, right, like that. There is that crista galli, so that it looks like the crest of a rooster. Now, what does the crista galli do? It serves as an attachment for the falx cerebri here in orange, which is this longitudinal structure of dura mater that separates our cerebral hemispheres, and then right there attaches and anchors to the crista galli. All right, now let's zoom in and show the lesser wing of the sphenoid bone there in yellow, which is on the anterior cranial fossa, and you can see those the anterior clinoid tube processes, lesser wing. Now the greater wings are in the middle cranial fossa, which on either side of the body of the sphenoid where the sella turcica is located. All right, so now let's go into this area of the sella turcica. So we zoom in. And so there's something called the anterior clinoid processes right there that serves an attachment for the tentorium cerebelli. And then there's the posterior clinoid processes right there. Now what happens is these two anterior and two posterior clinoid processes, anatomists looked at that and they said, what should we call these? And well, the term clinoid is Latin for bed because it kind of looks like a four-poster bed. 1, 2, 3, 4. And what's in the middle sleeping? Our pituitary gland. And so the hypophyseal fossa there houses the pituitary because hypo means below and facile means outgrowth, and that's the pituitary gland. It's an outgrowth of the hypothalamus. All right, and so here's a sagittal section of the skull, and there is a hypophyseal fossa because it's what houses our pituitary gland. Now here we have the dorsum celli, where dorsum means behind and celli means saddle, or the back of the saddle. And so there we've got in the sagittal section, there's the hypophyseal fossa, and there's the dorsum celli with the yellow arrow. Now the sella turcica then is a combination of things. It is the hypophyseal fossa plus our two posterior clinoid processes plus the dorsum celli. That's what makes the sella turcica. And sella turcica translation is a Turkish saddle because that's what it looks like. Now in this x-ray, we're going to zoom in. There is the hypophyseal fossa, and there is the dorsum celli, and there we have the sella turcica. Now, often in anatomy, we'll just call that whole thing the sella turcica, okay? Now, if you find it below the sella turcica, if you were to punch a hole through that saddle, you're in the sphenoid sinus. If you find the sphenoid sinus, you're like, oh, there's the maxillary sinus. If you find the maxillary sinus, oh, there's the hard palate. Hey, and if you find the hard palate, there are the maxillary teeth. What happens is I look for happy faces in x-rays. If I find one thing like the sella turcica, it introduces me to other things in the skull. All right, now this is a superior posterior view of the base of the skull. We're going to go over optic canal and supraorbital fissure. There's our optic canal coursing into the orbit for cranial nerve 2 and ophthalmic artery, and there's the supraorbital fissure also going into the orbit, and I've only shown one on either side, but they're bilateral. Supraorbital fissure is for the superior ophthalmic vein, cranial nerves 3, 4, V1, and 6. Now let's do the same thing from this view. There's our optic canals, and there's our superior orbital fissure. Now the foramen rotundum is right there, and rotundum means round. So it literally means the round hole. From this view, you can see that round hole, and is from that view, the round hole. Now, that is in contrast to this foramen ovale, and ovale is Latin for oval, for this oval-looking foramen right there. Now, the foramen ovale is for the V3 nerve. So there's our trigeminal nerve, cranial nerve 5, and there's V3 going through the foramen ovale. On the bottom of the skull, that's where V3 goes into the infratemporal fossa and supplies the mandible, tongue, and lower part of the oral cavity. The foramen spinosum is there, and that foramen spinosum gives rise to the middle meningeal artery that supplies the dura mater, and that's where the pterion is located, where it could get fractured. All right, now the foramen lacerum is there. Now the foramen lacerum is actually filled with cartilage, so it's really kind of it's a good landmark to show, okay? Now the carotid canal, however, is in a tunnel right there. There's our carotid canal. And so here in this lateral view of the skull, and you see brain, cerebellum, and arteries, there's our internal carotid artery. And there is the carotid canal, and what we're seeing is that opening, the top of the canal. Now, the lesser and greater petrosal hyeti. So here we're zooming in. There's the Framinal Valley and the Framin Lacerum as landmarks. And so there's the lesser petrosal hiatus and the greater petrosal hiatus. Now, the lesser petrosal hiatus gives rise to the lesser petrosal nerve that goes through the Framinal Valley with V3, but the lesser petrosal nerve, after synapsing in the otic ganglion, innervates our parotid gland. Now, the greater petrosal hiatus, which a hiatus is an opening, gives rise to the greater petrosal nerve that traverses kind of through that Framin Lacerum, synapses in the pterygopalatine ganglion, and then innervates the lacrimal and nasal palatal glands to make your eyes water and mucus to give you moist mucous membranes. There's our greater and lesser petrosal hiatus. Now, the internal acoustic meatus is right there. Internal means inside, and acoustic means to hear. And so there we've got this coronal section again. There's our internal acoustic meatus with cranial nerve 7 and 8 going into our internal ear for the cochlea and semicircular canals for cranial nerve 8. Now, there's our external acoustic meatus, which is the external ear. Now, I'm showing this because the external and internal acoustic meatus is not like a train tunnel from one in and out the other, because the middle ear is what separates this. The internal ear as well, but basically that middle ear. So it goes external ear, middle ear with the malleus incus and stapes, and internal ear, the cochlea and semicircular canals. Now, the groove for the sigmoid sinus is located right there. And here we have a posterior superior view, and that in blue is the sigmoid sinus, the dural venous sinus that goes through the jugular foramen. And so there is the jugular foramen here. And jugular means neck or throat. Now, why do we have this? Well, we take a look at the jugular foramen, and there's the jugular foramen. The sigmoid sinus then becomes the internal jugular vein that courses all the way down the neck, hence why the vein in the neck, the jugular vein, goes through the jugular foramen. Also going through the jugular foramen are 3 cranial nerves. Cranial nerves 9, 10, and 11 go through that. And so there is the jugular foramen for the IJ and cranial nerves 9, 10, and 11. In addition, we have the foramen magnum, and the word foramen is whole, and magnum means really great, large, big. Okay, it's the biggest foramen or hole of the skull, and it traverses the spinal cord, or the spinal cord goes through that. We see the spinal cord come up, and right there is that foramen magnum. It also traverses the vertebral arteries coming off their subclavian artery, going up through the transverse foramen of the cervical vertebrae, over C1, and ascends up through the foramen magnum. And finally, the spinal accessory nerve, where we see there in yellow, coming up through the foramen magnum, and it also then goes up over the base of the skull and then descends to the jugular foramen to innervate the traps and sternocleidomastoid. But for this moment, the spinal accessory nerve there traverses the foramen magnum. All right, now the hypoglossal canal is located right there. Now, why is it called hypoglossal canal? Well, if we zoom in, here we have the spinal cord and the foramen magnum, but off of the medulla spinal cord, it's actually from the medulla, we got this hypoglossal nerve, okay? And this hypoglossal nerve is going to then traverse right there, that hypoglossal canal, and then right there, that hypoglossal nerve courses all the way up below the tongue. So the nerve that goes below the tongue, because this prefix hypo means under and glossal means tongue. And so it's called the hypoglossal canal because it is the canal that gives rise to the nerve that goes under the tongue. I'm going to do a bit of a tangent here. So when I first took anatomy a little while ago, in January 1995, was the very first time I took anatomy. In my very first lab, we learned the skull. And I remember when I'm looking at pictures of the skull, I remember thinking, this just looks like a bone that someone shot with a machine gun and said, hey, why don't you learn all those holes? So I had to learn these somehow, and I'm not very good at memorizing, which is I recognize as ironic because I'm an anatomist. So what I did is I printed this off, and then I took this and I laminated it. And then I took this laminated picture of the skull and I went shing, and I stuck it in my shower. So every morning when I was showering, I'm like, la, 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 and I'm showering. I'm actually reading through these, looking at this and becoming familiar with the words. And then when I was shaving or, brushing my teeth, I'm looking at another picture of the skull. And when I'm doing some other business in the bathroom, I've got other pictures on the wall that I'm reading. So every morning I spent like 15 minutes, 20 minutes in the bathroom at different stages of getting ready for the morning, becoming familiar with the jargon so that so the words became familiar. And I'll tell you, since January 1995, I've never forgotten any of the foramen of the skull. And it's kind of funny, this picture, which of course these are not my bathroom from college, but just like my roommates, there's never toilet paper in there. All right, so now let's continue off the tangent and let's continue and let's show the cranial base. And so the cranial base, which is the inferior view of the skull, let's start with the bones. So there's our frontal bones, which you just see a little bit of, but then there's the zygomatic bones of the cheek from the bottom. And I should note that the mandible is removed from this image. And then the maxilla that not only forms the upper part of the jaw, it also forms part of the hard palate. The other part of the hard palate is formed by the palatine bones there on the back of the hard palate. So if you run your tongue over the roof of your mouth, the hard part is the hard part, and then the clucky thing at the back, that's your soft palate. The vomer bone is here. It's at the very back of the nasal septum. So in this picture right there, I've outlined the nasal septum, and the vomer bone is the back part. And it gets its name because vomer is Latin for plowshare. So when we now take a look, shing, we see that a plowshare blade looks just like the vomer bone, hence the name. Now the sphenoid bone forms part of the base of the skull there in yellow. And then the parietal bones, you can see forming part of the wall. And then the temporal bones, a good chunk of them forming the base of the skull, as well as our occipital bone. Okay? So some of the landmarks. Well, let's zoom in. There's the incisive foramen there that gives rise to the incisive nerve that supplies part of the hard palate. Now, the incisive nerve and arteries are formed by our nasopalatine nerve and sphenopalatine artery that come together at the incisive foramen, becoming the incisive nerve and artery, and they supply part of the anterior portion of the hard palate. That's a picture that I drew in grad school like 20 years ago. All right, so now there's the greater palatine foramen, greater because it's bigger. Palatine, it's on the palate, and it's a hole. And this supplies much of the mucosa of the hard palate. So this is a view as if you open your mouth really wide and the upper part showing the maxillary teeth. There's the greater palatine foramen giving rise to the greater palatine nerve and artery that supplies the hard palate. If you have a greater, you must have a lesser palatine foramen, and that is located right here, and it gives rise to the lesser palatine nerve that does sensation to the soft palate, the clucky part at the back of your palate. So now the pterygoid process of the sphenoid bone is right there, and it has the following parts: the medial plate of the pterygoid process, the hamulus, which means hook, where the tensor veli palatini hooks around, and then the lateral plate of the pterygoid process of the sphenoid bone in the house that Jack built. Now that lateral plate helps with our pterygoid muscles. So not our temporalis and masseter, but I just show those as references because if we do this dissection and go shing and cut that out, there's our lateral pterygoid and our medial pterygoid muscles, and the lateral pterygoid and medial pterygoid attach laterally and medially to the lateral plate. All right, so now let's talk about the mandibular fossa, which is located there in the temporal bone. And so this mandibular fossa articulates with the mandibular condyle there to give us our temporomandibular joint. So the key to it is right there at the mandibular fossa is the part of the temporomandibular joint. Now, the petrotympanic fissure is located right there. It's located between our mandibular fossa and the carotid canal is one way to find it. Now, the petrotympanic fissure gives rise to the chorda tympani nerve that goes right through that petrotympanic fissure right there and supplies taste to the front of the tongue and parasympathetics to our submandibular and sublingual salivary glands. It gets its name because the chorda tympani nerve courses through the petrous part of the temporal bone, rock, and across the eardrum, the tympanic membrane. Hence the name petrotympanic fissure for the course of the chorda tympani nerve that exits this opening. Now the foramen ovale, we look at the base of the skull, we're like, where is an oval-looking foramen? There it is. That's oval looking. And then just to the side and posterior to it is this very tiny one there, the foramen spinosum. And then medial to the foramen ovale is where we find that foramen lacerum. And then there, right behind the foramen spinosum, is our carotid canal. Now, the carotid canal, again, here we see a lateral view of the neck from Gray's Anatomy, and there's our internal carotid artery. And so, what happens at the base of the skull is the internal carotid artery goes through the carotid canal there, and then into the cranial vault at the exit of the carotid canal there. So, there is the carotid canal. That is its bottom opening into the carotid canal, which is where the yellow arrow is pointing. So now the jugular foramen is located just behind the carotid canal and the styloid process of the temporal bone. There it is, where that word styloid is Greek for pillar-like. It's a very pointy landmark as shown there in this lateral view of the skull. But you may have, if you're studying osteology, recognize I've heard that word styloid before. It's the styloid process of the radius and styloid process of the ulna. It just means pillar-like. Styloid process, in this case, of the temporal bone. It's where you've got muscles and ligaments attaching to it. Now, the mastoid process of the temporal bone is located there. Reminder is that bump right behind the ear. And then there is an opening, and anatomists said, what do we call this opening between the styloid process and mastoid processes? I know, we'll call it the stylomastoid foramen. And that gives rise to the facial nerve. And so the facial nerve goes through the internal acoustic meatus and then gives rise to the facial nerve proper branch that descends through the facial canal. And then that facial nerve proper courses down through the facial canal, through the bottom of the skull, through the stylomastoid foramen, through the parotid gland, and that facial nerve proper innervates all these muscles of facial expression. There's the stylomastoid foramen. All right, so now the foramen magnum is this really big opening on the base of the skull where you see vertebral arteries, cranial nerve 11, and the spinal cord. So the occipital condyles are here, and occipital means the occipital bone and condyles are these knobs, and they articulate with V1. Now let's talk about a different subject. Well, not different. We're going to continue, but we're going to look at something called the cranial fossa, which are three large stair-like depressions in the floor of the cranial cavity. So here we have the anterior, middle, and posterior cranial fossa, but it's hard to see these stair-like depressions. So let's take a look at the same thing from a mid-sagittal lateral view. There's our anterior cranial fossa, middle cranial fossa, and posterior cranial fossa. However, you don't really in the health sciences look at too many illustrations like this, and often what you see is it's through an x-ray. Now, to see and appreciate the x-ray, let's do the following. Let's take a look, and I'm going to draw horizontal lines, from the floor of each of these three fossae, okay? And then what we're going to do is with an x-ray, which flattens everything. So let's just take this image and go, yeah. And I didn't completely flatten it, but it's flattened enough. So what happens is when you're looking at the front of an x-rays, what the illustrations on the left are showing, and what the view is what you see as this x-rays, notice what happens. There's the level of the anterior cranial fossa. Now look at the x-ray. There it is. That's the anterior cranial fossa. Now in red, there's the floor of the middle cranial fossa there. And then in green, there's the floor of the posterior cranial fossa. So there you get these three stair-like depressions in the floor of the cranial cavity. So that, my friends, is showing the skull anatomy in a nutshell.